NHS Greater Glasgow with Clyde is a massive health board. They had the challenge of trying to deliver a vision for their redesign of services. There was an acute service review taking place, for example, 6 acute settings down to 3. But the thing that they really wanted to achieve was to increase the clinical pharmacy services on their wards.
I've always believed throughout my career that pharmacy staff offer patients a better service when they work close to the patient and integrated as part of the clinical team. So the idea was, how could we release those staff to integrate them into ward-based teams so that they could use their skills for the benefit of patients.
So what we were faced with was, how do we work with the health board to redesign the way that their pharmacy services work?
How we approached it was understanding that new technologies were available, IT, such as the Ascribe system, robotics that you see behind me here, and also the ability, because we were one big managed service, to be able to consolidate services to allow us to release staff for that frontline role. What we decided to do was to build this facility here, which has replaced 14 pharmacy stores, managed by 140 staff previously. In here now we have 40 staff, aided by our robotics that you see behind me here. From being able to do that, and we had to release enough revenue to pay for dedicated transport, to pay for the rental of this place here, we managed to free 40 staff for redeployment onto the wards, and that allowed us to double our clinical pharmacy service effectively. The hospitals will use the Ascribe system to order medicines from the wards, and this facility here buys all the medicines, so we have one buying point for the whole of the health board. We bring all the medicines into here, which is in excess of £100 million a year we spend on medicines. We bring all those medicines in here and then we distribute them using our robots to over 4,000 destination points.
Being web-based, we can support the massive number of transactions that they have passing through between the wards and the pharmacy distribution centre per day. But now it's all on one system, one reporting system as well. It's an incredibly powerful solution for them.
This is the interface between our Ascribe system, which is out there in our 14 hospitals, and our robotics here in the pharmacy distribution centre. Carol here is processing the orders that our staff working at ward level have sent to the facility. And what she's doing is she's organising them so that the robots will pick in the order we want them to pick in.
At the PDC we have 8 robots, each holding 14,000 packs and 3,000 different lines. In the course of a day we can issue up to 10 to 12,000 packs per day. We have 8 different prologues, and each prologue uses barcode technology to fill. It is scanned through here and then it goes onto the conveyor belts. The other way the robot takes drugs in is by front loading. We scan the barcode here and it reads on the machine exactly what it is, puts it in here, and then it goes onto the conveyor belt. When the orders are put through a scribe at the sites, then we print off the picking tickets. As soon as we print off the picking tickets, the robots start to work. They start to fill that order. The order then gets placed in the box. We don't check the robot items because the robot doesn't make mistakes. So that just goes in there. The manual items are picked. The box is then sealed and then put on cages for transport. The
relationship we have with Ascribe is very much a partnership one. In fact, I think the last thing we wanted would be a supplier. We were looking for somebody who we could work in partnership with to develop the technology to be able to meet our needs.
Ascribe were delighted to have the opportunity to work with colleagues in NHS Greater Glasgow and Clyde. It has been a very strong partnership throughout the whole of the implementation project. The staff that we have worked with on the project have been incredibly dedicated and have worked very, very well with our project managers in Ascribe. I think communication throughout the whole of the project has been key to this success, but underpinned by a very, very strong web pharmacy solution.
We've improved our access to a clinical pharmacist by our inpatients from 60% to 80%. That's among the poorest performing in Scotland to among the best performance in Scotland. We allow access to our Making the Most of Your Medicines project, which is the medicines management project, from 36% of our beds covered by that to 75% of our beds currently. and we hope that will be 100% by the end of this year. At the same time, we've saved £1.6 million, so we're doing it for £1.6 million less. We have saved, in terms of wastage in medicines, we've saved £1.5 million a year, recurring, every year. We're doing it with 5% fewer staff. So I think whatever number of measures you want to ask me, I think we can demonstrate the success of this project.